Welcome to your comprehensive guide to levothyroxine sodium, the powerhouse behind thyroid hormone replacement therapy. Whether you're newly diagnosed with hypothyroidism or looking to refine your treatment options, this video will equip you with the knowledge you need to make informed decisions about your health. Levothyroxine sodium, commonly known as Synthroid, is a synthetic form of the thyroid hormone thyroxine. It is prescribed to individuals whose thyroids do not produce enough of this vital hormone, helping to regulate metabolism, energy levels, and other crucial bodily functions. Throughout this guide, we will delve into the benefits, side effects, and dosage considerations of levothyroxine sodium. We will also explore alternative treatment options, potential drug interactions, and lifestyle tips to support your thyroid health. At Brand Name, we understand the complexities of thyroid hormone replacement and believe in empowering our readers to take control of their well-being. Join us as we uncover the intricate details of levothyroxine sodium and how it can profoundly impact your thyroid health. Remember, while this guide aims to give you a comprehensive overview, it is essential to consult with your healthcare professional before making any changes to your treatment plan. Let's dive in and unlock the full potential of levothyroxine sodium. Understanding the thyroid gland and its function. The thyroid gland, a small butterfly-shaped organ located in the front of your neck, plays a crucial role in regulating your body's metabolism. It produces hormones, including thyroxine, T4, and triiodothyronine, T3, which control various bodily functions such as energy production, body temperature, and heart rate. When the thyroid gland fails to produce enough hormones, a condition called hypothyroidism occurs. What is levothyroxine sodium and how does it work? Levothyroxine sodium is a synthetic version of the thyroid hormone thyroxine. It is chemically identical to the hormones naturally produced by the thyroid gland. Levothyroxine sodium works by replacing the deficient thyroid hormones in individuals with hypothyroidism, effectively restoring the body's metabolic balance. As a synthetic hormone, levothyroxine sodium is available in various brand names, including Synthroid, Levoxyl, and Tirosint. These medications come in tablet or liquid form, allowing for easy administration. Once absorbed into the bloodstream, levothyroxine sodium undergoes conversion in the body to its active form, triiodothyronine, T3, which is responsible for the regulation of metabolic processes. Common reasons for needing thyroid hormone replacement. Several factors can lead to an underactive thyroid, necessitating the need for thyroid hormone replacement therapy. The most common cause of hypothyroidism is an autoimmune condition called Hashimoto's thyroiditis, where the body's immune system mistakenly attacks the thyroid gland. Other causes include surgical removal of the thyroid, radioactive iodine therapy, and certain medications that interfere with thyroid hormone production. It's important to note that hypothyroidism can affect individuals of all ages and genders, although it is more prevalent in women and tends to increase with age. If you experience persistent symptoms such as fatigue, weight gain, hair loss, and depression, it is essential to consult with a healthcare professional to determine if thyroid hormone replacement therapy is necessary. Signs and symptoms of hypothyroidism. Hypothyroidism can manifest in a variety of symptoms, which may vary from person to person. The signs and symptoms of an underactive thyroid can be subtle and easily overlooked, often leading to a delayed diagnosis. However, early recognition and treatment are crucial to prevent further complications. Some common symptoms of hypothyroidism include fatigue, weight gain, dry skin, hair loss, cold intolerance, constipation, depression, and impaired memory and concentration. Individuals with hypothyroidism may also experience menstrual irregularities, muscle weakness, and elevated cholesterol levels. If you suspect you may have an underactive thyroid, it is important to consult with a healthcare professional who can perform a thorough evaluation, including blood tests to measure thyroid hormone levels. The importance of proper diagnosis and dosage adjustment. Accurate diagnosis and appropriate dosage adjustment of levothyroxine sodium are vital for effective treatment of hypothyroidism. Once diagnosed, your healthcare professional will determine the optimal dosage based on your individual needs. This dosage may need to be adjusted periodically based on your symptoms and blood test results. It is crucial to adhere to the prescribed dosage and follow up with regular blood tests to monitor thyroid hormone levels. Taking too little levothyroxine sodium can result in continued symptoms of hypothyroidism, while taking too much can lead to symptoms of hyperthyroidism, including rapid heartbeat, anxiety, and weight loss. Potential side effects and how to manage them. Like any medication, levothyroxine sodium may cause side effects in some individuals. Common side effects include headache, fatigue, sweating, and changes in appetite. These side effects are generally mild and tend to resolve as your body adjusts to the medication. In rare cases, individuals may experience more severe side effects, such as chest pain, palpitations, or allergic reactions. If you experience any concerning symptoms, it is important to seek medical attention promptly. To minimize the risk of side effects, it is important to take levothyroxine sodium as prescribed and avoid taking it with certain medications or supplements that may interfere with its absorption. It is also crucial to inform your healthcare professional about any existing medical conditions or medications you are taking to ensure the safe and effective use of levothyroxine sodium. Tips for taking levothyroxine sodium effectively. To maximize the benefits of levothyroxine sodium, it is important to take it as directed by your healthcare professional. Here are some tips for effectively managing your thyroid hormone replacement therapy. Take levothyroxine sodium on an empty stomach, at least 30 minutes before breakfast or other medications. Food and certain medications can interfere with its absorption. Avoid taking calcium or iron supplements within 4 hours of taking levothyroxine sodium, as they can impair its absorption. Be consistent with the brand of levothyroxine sodium you use. Different brands may have slight variations in bioavailability, so it is important to stick with the same brand unless otherwise directed by your healthcare professional. Do not abruptly stop taking levothyroxine sodium without consulting your healthcare professional. Sudden discontinuation can lead to a rapid decline in thyroid hormone levels, causing undesirable symptoms. If you miss a dose, take it as soon as you remember. However, if it is close to the time for your next scheduled dose, skip the missed dose and resume your regular dosing schedule. Do not double the dose to make up for a missed one. By following these tips, you can ensure the optimal effectiveness of levothyroxine sodium and minimize the risk of potential complications. How long does it take for levothyroxine sodium to work? The time frame for levothyroxine sodium to take effect can vary from individual to individual. Some individuals may start experiencing improvements in their symptoms within a few weeks of starting treatment, while others may take several months. It is important to keep in mind that levothyroxine sodium is not a quick fix and requires consistent use for optimal results. Your healthcare professional may need to adjust your dosage periodically based on your symptoms and blood test results to ensure that you are receiving the appropriate amount of thyroid hormone. Alternative thyroid hormone replacement options. While levothyroxine sodium is the most commonly prescribed thyroid hormone replacement medication, there are alternative options available. These alternatives include natural desiccated thyroid hormone, NDT, and liothyronine, T3, medication. Natural desiccated thyroid hormone is derived from porcine thyroid glands and contains both T4 and T3 hormones in varying ratios. Some individuals find that NDT provides a more balanced effect on their symptoms, although it may not be suitable for everyone. Liothyronine, on the other hand, is a synthetic form of the T3 hormone. It is sometimes prescribed as an adjunct therapy to levothyroxine sodium for individuals who continue to experience persistent symptoms despite optimal treatment with T4 hormone alone. It is important to discuss these alternative options with your healthcare professional to determine the most appropriate treatment approach for your specific needs. Conclusion: living a healthy life with levothyroxine sodium. Levothyroxine sodium, the synthetic form of the thyroid hormone thyroxine, is a powerful tool in the management of hypothyroidism. It plays a crucial role in regulating metabolism, energy levels, and other vital bodily functions. With proper diagnosis, dosage adjustment, and adherence to treatment, individuals with hypothyroidism can lead healthy and fulfilling lives. In this comprehensive guide, we have explored the intricacies of levothyroxine sodium, including its benefits, potential side effects, and dosage considerations. We have also discussed alternative treatment options and provided tips for effective management of thyroid hormone replacement therapy. Always remember to consult with your healthcare professional before making any changes to your treatment plan. They will guide you through the process and ensure that you receive the best possible care for your thyroid health. By taking an active role in your treatment, you can unlock the full potential of levothyroxine sodium and live life to the fullest.